As an anesthesiologist who has been practicing for 18 years now, I have seen a lot of instances where a family member comes with a patient during an outpatient surgery, but then they leave the premises to go somewhere else and they say, call me when he or she is being discharged. This really irks me. And I find that a lot of times it is those husbands doing that. Drop their wife to the hospital, disappear. I'm going home to take a nap. Call me when she's ready for discharge. Or I'm going to let the dogs out. Now, I do see the part where some people literally do not have family members around them to do some of the tasks. And I have seen sometimes where mom is getting surgery and they have a child at home. They have school-age children. So dad does need to go home and drop these children to school, stay with the baby. I understand that. I understand those things. But I just feel like if you're having any major surgery, you're going to be out. You're unconscious. And that person in the waiting room for you is your next of kin, is your emergency contact. Sometimes during the middle of the surgery, things happen, and we have to go out to your family member and ask them questions. Sometimes we need to modify the surgery. Rarely, in certain cases, a patient will code. Their heart stops beating, they go into cardiac arrest, and we do need to go to that family member and ask them how they would like to proceed in such instances. If that person is at home, it's sometimes even difficult to get them on the phone, and we can't get that direct communication. I prefer, if you're going to the hospital with someone having surgery, you should stay there. Stay in the waiting room. Be available. The thought that someone loves you enough to be there with you. Here is another one. Oftentimes, the surgery proceeds faster than expected. You're having a colonoscopy. It's a 30-minute procedure. Your recovery stage might only even be 30 minutes, and you're ready to leave. Stay with your family member. Find somebody else to do the things at home that needs to be done. But what did your family member do? They left the hospital. Now the recovery room nurses have to call them. One other thing that this person is missing who left the premises, they're not there to hear the discharge instructions. They're not there to hear the diagnosis. They're not here to hear immediately what the doctor has to say about how the surgery went.